नमस्कार, सत श्री अकाल, आदाब, good morning, good afternoon, good evening, जहां से भी आप हमें सुन रहे हैं. Thank you for joining our live session. My name is Kunjan Mawar. हमें आपके host और दोस्त for today's FB live session. These are unprecedented, unpredictable times. Tell me, did you think it's possible to have the most experienced, highly qualified, compassionate doctors at the click of a button? Well, eGlobalDoctors is the answer with affordable, secure web application, online health care, remote consultation, membership option, personalized healthcare passport, and many more amazing features. If you are Indian origin living in US and if your parents are visiting for India and you are looking for medical consultation, look no further. Visit eglobaldoctors.com. They have umpteen specialties for you. Prescription will be provided. Response time is 1 to 3 days. Family members can participate in live video physician consultation for any part of the world. The consultation is usually up to 30 minutes. There are no restrictions and in-app messaging with doctor consultation, ID, and portable healthcare passport. In today's FB Live session, we will be exploring and providing more information about women's health with Dr. Maya Nambisan. Dr. Maya, she's a board certified OBGYN with a master's degree in public health. She has a degree in literature from UC Berkeley and completed her medical school at University of Illinois. She received her master's degree in public health from Yale University. Welcome to eGlobal FB Sessions, Dr. Maya. Thank you for giving us your time from your busy schedule. How are you doing this morning?
Thank you, Kunjan. Thank you for inviting me again. I'm doing great. I hope you're doing great too.
Yes, it's a lovely Saturday and it's an amazing, interesting topic that I am actually ready. So if you are ready, we will start with our questions.
I am ready.
Okay, wonderful. Thank you. So आज का जो हमारा topic है, today's topic, we will be talking about PCOS. So what is actually PCOS, Dr. Maya?
So we were talking about polycystic ovarian syndrome. It's a syndrome or a collection of symptoms. And three of the most common criteria are increased androgens or male hormones, menstrual irregularities, so changes in your menstrual cycle, and what was considered cysts on the ovaries, but are actually not cysts, they're follicles. So there should be about 12 on either side or both sides of the ovaries. Mm-hmm. So polycystic ovarian syndrome, the name it's a bit of a misnomer actually, because these are not cysts and cysts are not necessary to the diagnosis of PCOS.
Okay, thank you for that. And I would just like to mention right before you joined back, the live session, I was mentioning that we are live to you on Facebook page and we are also live coming to you from Instagram. So hop on your favorite social media to catch us with these amazing questions and interesting topic. So thank you for explaining what is PCOS. So what are the causes? Like, is there something that we can do from our side so we don't see something like that? So what causes PCOS?
It's what's called multifactorial etiology, meaning there's many different causes. Part of it is inherited. So if you have PCOS, there may be other people in your family with PCOS, but also lifestyle changes and environmental factors can cause PCOS. So, the etiology hasn't been completely nailed down. The cause has not been completely nailed down. We are still forming opinions, doing research, and trying to narrow down exactly the cause. One of the root causes has been thought to be insulin resistance. Many of the people with PCOS have problems with having a lot of insulin being produced by their body, but their body is not responding to the insulin levels.
Okay. So thank you for that. So how can this be diagnosed? Is there something we know at home, like if we see certain symptoms, or how this can be diagnosed?
So for the past 25 years, scientists and specialists have been working on diagnostic criteria, and there's not true consensus still, but most people recognize the Rotterdam criteria, which is evidence, again, of hyperandrogenism, which is increasing male hormone in the body. the polycystic ovaries or the increased follicles on either side. As we said, they're not really cysts, and signs of menstrual irregularities.
So we lost you somewhere when you were actually telling us about the diagnostic. So if you don't mind, can you please repeat that section?
Right. So the current thought process is that we accept the Rotterdam criteria, which is evidence of elevated androgens or male hormone, evidence of evidence of an ovulation or oligo-ovulation, either no ovulation at all or very seldom ovulating, and evidence of polycystic or increased follicle count on the ovaries. And these could be clinically diagnosed or diagnosed through a lab assay.
Okay, so what are the signs and symptoms for somebody to know at their home that it's actually time to go and see an OBGYN?
Well, one of the first criteria is having irregular menses. So if your period comes, every 3 months or so, or as seldom as every 6 months, or you go a whole year without a period, there may be something going on with your ovulation. In addition, you have to have one of the other criteria to diagnose it at home. So if you notice at the same time that you're getting increased acne or hair growth, the acne is not the typical acne that you see, but more like an inflammatory acne, which means that it's also cystic. And it spreads and it's red and it's harder to get rid of. You can't really treat it with topical medications. The hair growth is thick, dark, what we call terminal hairs, and they're in a more of a male pattern. So they're in areas where a female wouldn't typically find the hair. So those are some of the signs that may clue you in that you potentially have this syndrome. I can't hear you.
Well, thank you. And I'm sure that our listeners and viewers who are actually watching us right now taking notes, and hopefully nobody has to go and see an OBGYN for symptoms like this, but just in case, if you are wondering, here they are. So is it true that PCOD causes weight gain? Like, does it have any side effects?
Actually, only 50% of women with this syndrome is obese, but there is kind of a chicken and an egg situation here, because if you're obese or overweight, obese really, not just overweight, obese to start with, you have increased androgens, increased male hormone. And so that can cause you to have PCOS symptoms and rule you in for the syndrome. In addition, when you have insulin resistance, you can increase, that can cause weight gain. So you could become obese from the syndrome itself, but not everybody with the syndrome is obese.
Got it. Thank you so much. So that is not one of the criterias, but it could be depending on a certain type of people. Okay. So are there any foods or any recommendation that we should avoid, or any foods that actually we should be consuming?
Well, actually, no. So diet and exercise, and I know we'll talk a little bit about lifestyle modification, has been shown to improve PCOS in many people, not in everyone. But when they compare different diets, you would think maybe a low carb diet, for instance, would be more efficacious. But when they actually compared the different diets, they showed that there was no statistically significant improvement in PCOS with the different diets. Any diet which lowers your calories and causes you to lose weight can improve your PCOS.
Okay. Okay, so that's actually good. So at least there is no diet restriction. You can do, if somebody is concerned about it, have your regular diet, and exercise is very important. No matter, what we have been talking about, I think food and diet is really important part of that topic. So then my next question is there a particular age that after that age, yes, there's a possibility you might get it? Otherwise, how we know that who can actually get PCOS?
So it's quite difficult to diagnose in adolescence. So in the teenage years when puberty is just starting from 12 beyond in most cases. But it's actually in adolescence that you can be sure that you have it. So in adolescence, when people are going through puberty, they have hormonal changes. They may have acne. They may notice some changes in their menstrual cycle, especially within the first few years after the period start. But if 3 to 4 years after the period start, they who are diagnosed with menstrual irregularities in their late 30s and 40s, they are less likely to have this syndrome. They may have PCOS for other reasons. And that's why it's very interesting, or not PCOS, rather than menstrual irregularities for other reasons rather than the syndrome itself. And that's why it's very important when we're diagnosing PCOS to rule out other causes. There are other hormonal causes and lifestyle causes that could change your menstrual cycle.
Okay, well, that's something very interesting to know. I did not know about that. So thank you for educating us on that. So then if someone has PCOS, what medical problem the person might be at risk for?
So the number one thing everybody thinks about, which is correct, is infertility. If you're not ovulating, there's no chance for the egg that drops every month to get fertilized, and that makes it difficult to get pregnant. In many cases of oligo ovulation, meaning infrequent ovulation, people can still get pregnant spontaneously by themselves without help, but it takes a much longer time. So that's one issue. Another issue is that they're more at risk for things like diabetes because they tend to be insulin resistant, and that causes a situation where you're more likely to become diabetic. Because you're diabetic and half the patients are obese, they are at risk for cardiovascular complications. And one of the things that is most concerning is that people who don't have their period frequently every month, they don't clean out the tissue inside the uterus. So that tissue grows over time.
Okay, so you did touch upon that if somebody has PCOS, their chances of getting pregnant and hormone imbalances, there is a high risk of having this. So I think this is where you were discussing and we lost you. So does it happen with every single person who has PCOS that they won't be able to get pregnant, or is it case by case?
It's really case by case because some people do ovulate, although not regularly. And so they are spontaneously able to get pregnant. And some people just need a little help with that, and we can provide that help.
Okay, so there is light at the end of the tunnel, but it's really a case by case. Okay. Yeah. So you did touch upon it that PCOS is hereditary. So I'm assuming that's a correct statement.
It can be hereditary, not in all cases, because like cause is multifactorial. So some of it is inherited, but some of it can be environmental.
Okay. And then I checked, we don't have any questions from the live. So my last question for the day is, what are some lifestyles modifications and home remedies that someone can follow to avoid PCOS?
Well, there's no real home remedy, but lifestyle modifications are truly geared towards diet and exercise and losing weight. As we talked about, there's no specific diet that is more efficacious than the other. And studies have shown that even a 5 to 10% weight loss can improve your overall symptoms of PCOS. So really, that would be the management at home. And then, as providers, we can offer you ovulation induction if you are having trouble conceiving. So if you're not able to get pregnant spontaneously, there are medications we can offer you. If you are not ready to get pregnant, but you're having some of these symptoms, there are many remedies out there that can help the symptoms and actually protect you until you're ready to have a baby. The most common medication out there, the best, cheapest, most easily available is birth control pills, which also, I think has been poorly named because it has so many other uses. And in addition to contraception and stopping you from getting pregnant until you're ready to, it can preserve the health of your ovaries. It can decrease the chance of acne and hair growth, excess hair growth. It can protect the lining of your uterus so that you don't get uterine cancer, as we discussed earlier. So there's a lot of benefits.
Okay, so if you or your loved one are struggling for something like this, there is hope. Go and contact your OBGYN and get the help you need. So thank you so much. With that, Dr. Maya, I am going to be wrapping our FB Live session today. So if you are worried about your medical needs, check out various health packages from eGlobalDoctors.com, bronze, silver, and gold. You can choose board certified doctors, USA or India prescription will be provided. They have umpteen specialty services. Please visit eGlobalDoctors.com. Video consultation of 30 minutes, and the package can be used for you or your family members, and the response time is 1 to 3 days. eGlobal Doctor is one complete health care platform solution for all your medical issues and questions. And maze ki baat hai that you don't have to go anywhere. These services are available at the click of a button without breaking your bank balance and without leaving the comfort of your living room. So before I let you go, Dr. Maya, any word of wisdom that you want to share with our listeners, viewers right now?
Well, I would like to say that if you do suspect that you have this syndrome, please do contact your OBGYN. There are many things that they can offer you in terms of protection for the future and improving your chances to have a normal fertility and normal reproductive life in the future.
Wonderful. Thank you. So please do not wait. If you or your loved one is struggling, please contact your OBGYN. Well, there you have it. This is Arjit Kunjan signing off. Sayonara till we meet again. Stay tuned, stay safe, and keep smiling always. Thank you. Namaskar, Dr. Maya.